Thank you for joining the AAKP National Patients Meeting. I'm Ed Hickey, Vice President of AAKP and Chair of the Veterans Health Initiative. I'm a former Marine Infantry officer and I'm an attorney in Los Angeles, California. I'm active in the Armed Forces legal community here in California and work with the Veterans Legal Service Project of the LA County Bar Association to support the legal needs of active duty military personnel, reservists, and veterans. I'm also a former senior aide on Capitol Hill and a former senior advisor to the Director of the United States Civil Service. Like many of you listening today, I have a history of kidney disease in my family and have direct experience as a caregiver. I'm also a kidney patient and share the same sense of urgency to impact research and innovation to save and improve lives and reduce suffering. In 2019, AAKP launched the Decade of the Kidney. Our stated goal and objective is to help deliver substantive changes in kidney research and innovations in the next 10 years. In order to do this, patients must be involved in both research and communications, and we need to share our insights and personal stories more widely. Over the past several years, AAKP patient advocates have been highly successful in getting their viewpoints published in peer-reviewed medical journals. By doing this, we are impacting the research and medical communities. A major factor in this success has been our friend and ally, Dr. Ranish Mahorda, editor-in-chief of the Clinical Journal of the American Society of Nephrology. Under his leadership, C. Jason launched a strategic initiative that established patient voice editors and patient voice editorials. Based on metrics that measure media and social media impact, the patient editorials appearing on C. Jason are among the most impactful that C. Jason has ever published. We thank Dr. Mahorda and his C. Jason team for elevating our voices across the kidney community. Beyond medical journal, AAKP patients and allies are also impacting public and policymaker perceptions about the role of patients in kidney science and innovation through published books. And that brings us to our panel today. The individuals you will listen to in this session are AAKP members, board members, and allied medical professionals who have used their talents and the power of the written word to author well-received books and forthcoming books. Their topics range from kidney science and learning to very personal and emotional stories about their direct experiences with kidney patients and kidney disease. Each of these authors has our deep respect for their intellectual honesty, courage, and sheer guts to get in the public arena and share their viewpoints. I hope those of you who are watching today are inspired by their example. I encourage everyone listening to try your own hand at writing and publishing. Whether you write a letter to the editor, a blog, an article for a medical journal, or a book, the time is now to tell your story during the Decade of the Kidney. For today's session, Authors Corner, AAKP patients and affiliates advancing care, research, and shared decision-making through published work. I have the honor of conducting a series of interviews that we are privileged to share with you now.
The book is going to be called The History of the Kidneys, Treatment of Kidney Failure, A Tale of Racism and Corporate Greed. The book really is about the advances in therapy for the treatment of kidney failure that have happened over the last 70 years, including dialysis and transplantation. And it's about the biotechnological miracles that have happened, including the development of erythropoietin, but it's also coupled with some dark sides pertaining to corporate greed and racism in the allocation of care to patients with kidney disease. I was really inspired to write this book, not because of my background as a physician treating patients with kidney disease for more than 40 years, but because of the experiences of two friends. My college roommate, after we finished school, ended up donating a kidney as a 30-year-old man to a younger brother who had developed retroperitoneal fibrosis and lost his kidney function. 40 years ago, that was a huge gift because it required major surgery from the spine to the belly button to remove a kidney. That's quite different now when we have laparoscopic surgery. My friend recovered and is a very athletic, outdoorsy person, and he wanted to get the sagging of his muscles repaired after so many years. He ended up going to his physician and having a CAT scan so that the surgeon could be guided in repairing the musculature. And to everyone's surprise, in the remaining kidney, there was an abnormality, which turned out to be a malignant tumor. So he was going to have to lose a part of the kidney. 40 years ago, he would have lost the entire kidney, but because of advances in surgery, he was able to have just the area of the kidney with the tumor removed. And he had a very rocky hospital course characterized by acute renal failure, or as we now call it, acute kidney injury, with the terminology of acute tubular necrosis being used medically. He came very close to needing dialysis, so he suffered all the consequences of having AKI. When he left the hospital, because he had lost 1 1/3 kidneys over his life, he became a CKD patient. He had only minimal renal function. The second case was a friend of mine who is a public intellectual, Dr. Sally Sattel, who also had kidney disease since her youth, which progressed over many years to the state that she needed transplantation. She did not have relatives to provide a living related donor kidney, and she was very much against starting dialysis for personal reasons. So she set out on a quest to try to find an unrelated donor. She had many difficulties, but finally, a friend of hers from the journalism world donated a kidney to Sally, and she did very well. They reported their mutual relationship in the press, and Sally was very grateful to Miss Postrel, her donor. After several years, that first kidney failed, and Dr. Sattel was able to obtain a kidney from yet another altruistic donor. I think this story is an amazing story of how friendship and altruism can help people who have come to the stage of end-stage renal disease. So because of these two people, I decided to write a book that would deal with the history of kidney failure and its treatments starting in the 1950s. In the 1950s in Seattle, Dr. Belding Scribner began his studies, which culminated in the development of the Scribner Shunt, building on work that Dr. Kolf, who's on the screen right now, had done after developing dialysis techniques. Dr. Scribner was able to create a Teflon shunt, which allowed patients who had chronic kidney disease to be dialyzed again and again using the same access. And you can see that Dr. Scribner is holding an early dialyzer. Dr. Scribner and Dr. Schreiner were able to convince the United States government to enact H.R. 1, which made dialysis care available to people who had become end-stage renal disease patients as part of an entitlement through the Social Security Act. And these three gentlemen were responsible for setting up chronic dialysis as we know about it to this day. At the same time, at the Peter Ben Brigham Hospital, from the late 1940s through the early 60s, transplant surgeons, led by Dr. Joseph Merry, helped to make transplant a reality. For the first couple of years, they had a lot of problems. Heroic patients volunteered to be transplanted, but the transplants didn't last a long time because of lack of immunosuppressive drugs. Dr. Murray was able to show that transplant was feasible in a remarkable clinical experiment in 1954, where he transplanted twins successfully and showed that transplantation between twins was feasible. Over the next decade, researchers at the Brigham, along with other investigators, were able to pioneer immunosuppressive treatments that allowed patients to have an extended lifespan. One of these drugs was azathioprine, which was developed by Dr. Gertrude Elion and George Hitchings at SmithKline in Tuckahoe, New York, which remarkably extended the ability of patients to maintain the kidney transplant in good health. So over the next decade, what's happened is a biological, technological tour de force in terms of the biosynthesis of erythropoietin by scientists at the University of Chicago and at Amgen. And that drug in the late 1980s helped the quality of life of dialysis patients and transplant patients to a certain degree, remarkably. What I talk about in the book is that from the 90s until the aughts, the pharmaceutical companies tried to use the highest doses of erythropoietin possible to achieve the highest hematocrits with some adverse results. The last story that I tell in the book is about APOL1 variants, a search for the genetic underpinnings for the susceptibility of African Americans to kidney disease. NIDDK spearheaded a program called FIND, which identified a locus, MyH9, very close to APOL1. Investigators from the FIND study and from Harvard were able to delineate the exact gene variants at the APOL1 locus, which confer susceptibility to kidney disease. Finally, as we come to the present time, it's become apparent for the last several years that transplantation, which is a superior modality of treatment for kidney failure, has not been allocated equitably between the races in the United States. African American patients at every step of the transplant process have less chance of completing the steps and of obtaining a kidney transplant. So my book delineates many of the human stories of people who've had kidney failure, who've had to confront the disease, and who have triumphed over the disease, technological advances in dialysis and transplantation, and drug companies who sometimes put profit above patients, and genetic risks that confer differential outcomes on different peoples comprises really what the book is about. It's about technological advances medical advances, patients and doctors, but acknowledging corporate greed and racism in the treatment of patients with kidney disease. So that's a very long answer to a very good question. Thanks. I've taken care of patients for more than 30 years, and all my patients inspired me with their fortitude, their willingness to undergo treatment, their hopes of getting a transplant, their hopes of returning to their families, returning to society as people with good quality of life and people able to pursue their dreams. The AAKP has acquainted me with many people who are not my patients, but who are working as advocates to rectify some of the issues that I talked about earlier, trying to make transplant more available to all peoples in the United States, and to make the finances available. I think the AAKP has worked indomitably to help patients to afford transplantation with recent legislative efforts, and I have been extremely taken with their work, both as patients and as advocates.
I hope these interviews inspired you as much as they did me. And if you have not yet had the opportunity to read these books, I encourage you to do so and keep a lookout for those coming soon.